Hi, Dr. Windish. Uh, no longer from Sparks Pediatric and Adolescent Medicine, coming to you from somewhere here in the Deep South. Today's video, welcome to our video series for pretty much anybody who cares. Today's video is really in response to a question from a friend of mine in response to something I'd put out on social media. So to my friend and dragster engineer, drag racing engineer extraordinaire Dale, this one goes out to you. The question comes up, what is a monoclonal antibody? How do you make one? And why would you want one? And what does that have to do with the current world we're living in, April 24th, 2020? So I was waxing poetically on social media, wondering why, with all the talk I hear about, I hear a lot of talk about Plaquenil, and then there's another medication that was used in Ebola rather effectively in Ebola. A lot of talk about vaccines, but nobody's talking about developing monoclonal antibodies, although we talk about antibody testing. And I was kind of wondering, why am I not hearing about that? That was, I think I posted that on like Wednesday. Today on a certain international news station, I heard that China's actually already working on monoclonals and is getting ready to publish a paper out of China about this. So I guess somebody's actually been thinking about this, which is good. But you can hear a lot more about monoclonal antibodies and how they work. So by way of full disclosure, I am a general pediatrician who currently practices exclusively adolescent medicine. I have an undergraduate degree in molecular biology and spent some quality time in a molecular biology lab as an undergrad doing some research in the field, but that's been 30 years. So let's start with, what is an antibody? An antibody is a protein that part of your immune system called the B cell secretes in response to infection or in response to stimulation from something that doesn't belong there. Most of the time that's infection. Once in a while that's allergen. Once in a while it's just foreign protein that somehow got into the blood. And its job is to bind up that foreign protein and signal it for destruction by the immune system, by another part of the immune system called the T cells. Those antibodies should bind it, neutralize the protein, and then stimulate a T cell response, which T cells are the kind of Pac-Man of the immune system, and really they're kind of a Sherman tank type thing. They go in and just chew stuff up, quite literally. Antibodies have the advantage of having, if your body makes them, has the advantage of having memory. So when you see that foreign protein again, usually in the form of a virus, you recognize it and immediately respond. And so it protects against future infection. This is naturally occurring antibody. When you are exposed to a foreign protein, usually in the form of a virus, there, depending on how big the protein is, might conceivably be 10,000 different spots on the protein that your immune system recognizes as not belonging to you, and you'll make antibodies against each of those 10,000 spots. Those spots are called epitopes, so you might make antibodies to 10,000 different epitopes. Some of these antibodies work better than others to neutralize the protein, and work better than others to identify the protein as foreign and tag it for destruction. This is referred to as a polyclonal response because there's more than one antibody against more than one epitope. What we do with monoclonal antibodies is we identify a single antibody against a single epitope, and then using molecular biologic techniques make millions of copies, in theory, an unlimited number of copies. So how do we do this? Well, sort of depends on what kind of antibody we're dealing with. So most of the time in molecular biology, you're not actually dealing with viruses. You're actually dealing with stuff, that, especially in human molecular biology, which is the work I did. You're dealing with stuff that belongs inside the human body. So you're not supposed to make antibodies against it. So there's no antibodies to be isolated from the blood. So you've got to find a way to make antibodies. And you can do that by taking the protein and injecting it into an animal that's not human. Often rabbit, sometimes mouse, something like that. And you do it a couple of times to stimulate the immune system, and then you remove the serum from the animal. And you don't necessarily have to siphon the animal to death. You remove part of the serum. And first look for the presence of antibodies that you want to work with, all right? Then if you find what you're after, you've got to go collect B cells. And they usually collect those by doing a splenectomy on the animal, and in laboratories that usually ends poorly for the animal. You then collect the B cells, figure out which B cells are making the antibodies that you want, and you do that by diluting them down in a flask so that each flask has just a single clone of B cells, each one producing the same antibody. And when you figure out which one you want, then you pursue that. All right, so now we have a single clone, but we need to immortalize that clone. So you'll take that clone and you merge it with a tumor cell. Oftentimes it's some form of a myeloma cell. And that's because tumors, the nature of a tumor is it's a cell line that doesn't die like it's supposed to. Cells are supposed to die on you. Otherwise, they become tumors and they just keep going. So we immortalize it with a immune tumor, like a myeloma. And then you can do one of a couple of things with it, depending on where you are in the process. In the old days, they would take that and inject that into the peritoneum, the abdomen of a mouse, and they would siphon the fluid that is secreted from that and obtain the antibodies from that. And we would use that for research purposes. To get the numbers you need for therapeutic use in humans, that's just not going to be doable. So, or even for commercial use. So they then, instead of injecting it into a mouse, they then spread it out in tissue culture, grow it up, and you simply siphon the fluid that's off the top of the cells. You take that off and you extract the antibodies from that. And there's a pretty simple technique called chromatography, by which you separate out all of the proteins and collect just the protein that has the antibodies in it. And, kind of go from there. In the case of COVID, and for that matter, we use monoclonal antibodies for other stuff, for other viral infections. So specifically, the one that's coming to my mind is something called palmizumab, which is a monoclonal antibody against a virus that makes premature infants really sick, called respiratory syncytial virus. We don't need to inject it into a rabbit. We simply find the B cells from someone who's had RSV, respiratory syncytial virus, find the neutralizing antibody that we want to work with, and then immortalize that B cell and then grow it up as a clone, which is kind of how they do it to make palmizumab. So for COVID-19, that's kind of what the goal here is. Once you have that antibody, you can then do a couple of things with it. The first thing you can do is use it for testing, and it becomes a very sensitive test. You got to use the right monoclonal antibody. You want one that'll be specific to the strain of virus you're working with, in this case, COVID-19. In the case of RSV, you want one that is general to all strains of RSV, not a specific strain of RSV, because you want to be able to test for all RSV in a patient. And then you can use that to do like a blood spot test, something called an antigen capture ELISA, where you coat the bottom of a plastic plate and then you put in serum and see if anything sticks. And then you can amplify a color signal to show up. And if it shows up, that tells you that whatever it is you have an antibody against, COVID-19, RSV, influenza, H1N1 strain, whatever, it'll tell you that protein is present in the blood, or that protein is present in the nasal secretions, or whatever it is you're looking for. And you can use that for evidence of infection. You can also grow up large amounts of this and then start to use it therapeutically. And this is what we do with the preemies with palmizumab, is they get injected with this once a month if they're high risk for having bad outcomes from RSV. They get injected with this stuff once a month at the beginning of RSV season, and we continue it till the end of RSV season. And it protects them against the virus, which RSV in a preemie is the number one reason a preemie gets readmitted to the hospital, and the number one reason that a graduate from the intensive care nursery might die after he's left the nursery. And it's quite effective. So something like this, if developed and was truly neutralizing, and if you use the right antibody such that it's not triggering a massive immune response and massive inflammation, could be given to people who are minimally sick, very sick, whatever, and alter the course of something like COVID-19. Now, the tricky part is making a monoclonal antibody is easy. As an undergraduate student, I made monoclonal antibodies for research purposes. It's not that challenging. I then had to work with experts to help me identify the monoclonal antibody and prove that it was appropriate for the tests that we wanted to use, and that it didn't cross-react with something else, that it was very specific, that it didn't miss the proteins we were looking for, blah, blah, blah. Using it as a medication, you need then to prove that it's effective, that it's not going to cause massive inflammation, that it's not going to cause allergy. If it looks like it's causing allergy, you can actually trim part of the antibody off to decrease your allergen risk. You remove what's known as the constant fragment and leave just the what's known as the FAB fragment, which is the variable portion of the monoclonal antibody, the part that's specific to what it is you're after. And that would bind up COVID, but it would actually decrease the risk of massive inflammation, because when you trim off the constant portion, it no longer is a signaling molecule, but it'll still, if you have a neutralizing antibody, it'll neutralize the protein and keep the virus from infecting other cells. You could use it even for prophylaxis in high-risk patients, proving the safety and efficacy of the developed monoclonal antibody, growing up industrial quantities of monoclonal antibodies. I mean, when I was making it, we were working in a small lab. We were growing microgram amounts. That's 1/1000th of a milligram. And sometimes we were growing nanogram amounts. That's 1/1,000,000th of a milligram. And when you're using it in a human being, depending on what it is you're after, some of the monoclonal antibodies they inject, they're injecting for like infliximab, I want to say it's upwards of 10 milligrams. you need industrial quantities, and that is outside of my pay grade. I didn't work in an industrial lab. But you're going to hear, my point here is not to tell you how we're industrializing the process, but rather to demystify what a monoclonal antibody is, why you want one, and kind of where they come from. So you heard me talk about cancer cells. I want to demystify one thing early on. You cannot get cancer from monoclonal antibodies. We use monoclonal antibodies to treat certain cancers, rituximab being one of them. But they don't actually cause cancer. And the cancer cells that we use to immortalize the B cell so that it can continue to produce antibody for us, that's removed at a very early step. These cells are gigantic, and your goal is not even to siphon them off. You want to leave them in the tissue culture so they can continue to grow and make more antibody for you. Anything that accidentally finds its way into the siphon liquid will be removed in the purification process. So the whole mention of cancer, people kind of shut down when they hear the C word. You're not going to get cancer from this. Assuming such a monoclonal antibody can be developed for therapeutic use. More likely and more quickly it'll be developed for laboratory use if it's not already being used in some of the laboratory studies that are being done internationally. I don't know what kind of technology various people are using. In this country, we're using PCR, and we're using antibody testing where we look for antibodies in you, but we're not using monoclonals to capture COVID. But at some point in time, someone may be using that. That's easier to develop. Developing it as a drug, to proving its safety, blah, 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 is challenging. However, it's still less challenging than developing a vaccine for a virus, which is why we don't have a vaccine for respiratory syncytial virus, but we do have infliximab, humanized monoclonal antibody against RSV, and we use it quite effectively. And we do that because 30 some odd years ago, there was a trial with a vaccine, but the vaccine actually caused massive inflammation when people got RSV, and anybody who got the vaccine got really sick, and the mortality rate was really high. And after that, everybody's been scared to come up with it or to do any work on a real vaccine for RSV. But infliximab or palmizumab is kind of a way to hedge your bet. It'll neutralize the RSV for the patient. It doesn't have any memory. Eventually, those antibodies that you gave the patient disappear from the system, and they have to be either redosed or they're gone. But you don't risk the massive inflammation, so it kind of avoids that quandary. Anyway, I hope this answers questions. Certainly, if I'm confusing, comment in the comments, and I'll try to clarify, or I'll do another video to clarify. Sometimes things make sense to me. My original musing on the social media, I didn't even put two and two together that normal people don't understand it. My friend is brilliant, and he's has a tremendous understanding of physics and engineering and electronics, and had no clue what I was talking about. Never would have dawned on me because he's a really smart guy. And just when he said, could you put it in English? I'm like, oh, yeah, I guess normal people don't know what monoclonals are. So sometimes what's obvious to me is not so obvious to the rest of the world. So if I'm not making sense, speak up. I'll clarify. You can also in the comments, if there's anything else you want to hear about, not necessarily COVID-19 related or COVID-19 related, or any of the above. If I know something about it, I'll be happy to talk about it, use computer models, whatever. Most of my videos these days are by request, so if there's something you want to know more about, speak up. And please patronize our sponsors, because that's what allows me to keep doing these videos. Anyway, stay safe. Coming to you from the deep south. I'll see you next time.